everywhere in Quebec, whether it be the number of cases, the number of hospitalizations, the number of deaths. So it really is very encouraging, and it allows us to go as planned ahead towards the next steps of our end of lockdown plan. I can't even say it properly. I'm too excited to be announcing this. Okay, so we're going to start talking with Dr. Arruda of the Stanley Cup Parade, but today I'm going to talk to you about colors, zone changes. So I'm happy to announce to you today that as of next Monday, Montreal and Laval will be going into orange zone. That means that secondary 3, 4, and 5 students will be studying full-time. It means that restaurants will finally be able to open, not just outside but inside. So not just terraces, same thing for the 3 parts of the regions that were in red. So Chaudière-Appalaches, Estrie, and Eastern Touches and Lower St. Lawrence are all going to go into orange. So that means that as of Monday, the 7th of June, there will no longer be any red zones in Quebec. Maybe before going to other regions, a word on Montreal. It's always difficult to predict what will happen over the upcoming weeks, but of course, in Montreal, the population is very dense, and we can expect that there will be an increase of cases in the following weeks in Montreal. But it has to be understood that public health is comfortable with it. There is some leeway, and vaccination continues going forward. So do not be surprised if you see that in the coming weeks, with the end of lockdown, there will be an increase of cases in Montreal that is predictable. For the other regions, I'm happy to tell you that there are regions going to yellow more quickly than planned. So the Saguenay-Lac-Saint-Jean, the Mauricie, and the Centre du Québec are going, as of Monday, the 7th of June, are going to be going into yellow. Same thing with the eastern part of Lower St. Lawrence. So Métis, Rimouski, and Matane will also be going to yellow. Yellow, what that means, amongst other things, is that bars can open, as well as team sports. So games can take place outside, as well as visits in people's homes for occupants of 2 different households. There are also regions that are going to green. So the Abitibi-Témiscamingue, Côte-Nord, as well as the northern area of Quebec are all going to green as of next Monday. And what does that mean concretely? It means that people can have games, so team sports inside are allowed. There will also be gatherings in people's homes that are allowed for the occupants of 3 different households, maximum of 10 people, or one of the 2, the highest of the 2. However, speaking of residences, people's homes, gatherings in people's homes, first, we have to remind you that even in yellow and green, when we say that it's allowed, it's with mask and with social distancing, as long as people have not received both doses of the vaccine. So it is important because I understand that people are looking forward to seeing one another, but if we only have the 1 dose of vaccine, you could contaminate a vulnerable person who could then have serious consequences of the illness. So what I'm saying is be prudent everywhere in Quebec, in people's homes, even in yellow or green zones. And know that there will be very good hockey games over the next few days. But first, there are restaurants that have large screens. And second, I heard Ron Fournier say that there are some people who are putting their television set on the balcony. You can do that if you want to invite friends on the balcony. So don't invite your friends inside. So I understand that people are looking forward to seeing one another. We saw over the weekend a little bit of people going overboard. We weren't surprised. It took place pretty much everywhere in the world. And of course, we weren't happy to see the violence and also the litter that were left in different parts, like Parc La Fontaine. But I would say that it is preferable The lesser of two evils is, of course, to get together outside rather than inside. And I understand that people are looking forward to seeing one another. Myself, I went to terrace of a restaurant with my wife. When we go to the table, we feel like chatting with neighbors that we haven't seen for a long time. It's almost like we've been traveling for months and all of a sudden we rediscover our neighbors, but we have to be very, very prudent as long as we haven't received our second dose. And now, speaking of second doses, Christian is going to be making an announcement of a calendar on Thursday. So in 2 days, for those who wish to get their second dose ahead of time. So we're going to be going by age group, which brings me to talk to you about young people. We have a challenge. Everywhere in the world is the same challenge, the 18 to 40-year age group. There are people who have still not made their appointment for the first dose. So you still have a few days ahead of you before we open things up for second doses. So there's a lot of available appointments. So go and make your appointment today and tomorrow before people start making their appointment for the second dose. And I can tell you that Christian is making many efforts. There's even vaccination that's being done, and it's going to be done even more and more, even in parks, even in the evening. We're going to go wherever young people are to be found, but that is our challenge. So let's talk among ourselves and let's try to encourage young people to get vaccinated. It is primordial to be able to get immunity, collective immunity. So we need you, young people, to be able to get to our objective. So to conclude, things are going well. When we look at the case, vaccination is going well. We remain the province that is vaccinating the most and the most quickly. Even when we compare ourselves to other countries in the world, we are one of the places in the world that is vaccinating the fastest. And the most numerous we are to get vaccinated, the faster we can start having little parties once again. So, English.
Thanks to all your efforts, the situation continues to improve in Quebec. I'm announcing that Montreal and Laval will turn orange on June 7th. Same goes for the MRC that were in red zones in Chaudière-Appalaches, Estrie, and Bas-Saint-Laurent. Also on June 7th, Saguenay-Lac-Saint-Jean, Mauricie, and Centre du Québec will turn yellow. The same goes for the MRC of Métis, Rimouski, and Matane in eastern Bas-Saint-Laurent. Also on June 7, Abitibi-Témiscamingue, Côte-Nord, and Nord du Québec will turn green, but we have to stay very careful with indoors gatherings. We need to keep our distances and wear the mask until we have our 2 doses. So with just 1 dose, there's a risk for vulnerable people. We have to progress gradually. On Thursday, Christian will announce the calendar for those who want to receive their second dose earlier. And I want to ask young people to get their first dose as soon as possible. We need you to get back to our normal life. The more we are with 2 doses of vaccine, the sooner we can restart our little parties. Thank you.
Merci.
So thank you. We will now start the question period for members of the media. Hello, Mr. Premier. Hello, everyone. On the question of the borders, we see more and more that there's pressure on the part of the U.S. government and tourist associations here as well. Prime Minister Trudeau has said that he wanted to consult the provinces. Mr. Ford was heard pretty clearly on the question. What do you think about it? Should we leave the quarantine aside? Are we going to open the border? Should we open the border? And if so, when? Well, yes, we did have a meeting over the phone on Thursday evening last with Mr. Trudeau and the different premiers. There is no consensus throughout Canada. Provinces like Alberta would like to open quickly. There are provinces like Ontario and Quebec that want to wait. We repeat, what we wish is first for people to have received their 2 doses before opening up. That is what I said to Mr. Trudeau. So not before the end of the summer. Yes, ideally not before the end of August. On another question, yesterday we saw those images of housing where there are employees from the MERS. How do you react to these images? Does the government have more important responsibilities that they should take for the production of temporary foreign workers for these unhealthy and substandard housing? And how should we fix it for them to be better treated? Well, first, I hope that it is an isolated case. The Minister of Agriculture spoke with Mr. Demers, who said that he was going to be correcting the situation and put the workers in other housing. It has to be understood that as far as the role of the government is concerned, it's more the federal government that has to make sure that the conditions are good for temporary workers who come to Canada. But I find it unacceptable, and I was happy to see that Mr. Demers thinks the same and that he wants to and he will correct the situation. Mr. Premier, I would like to come back to the proms. I think that you were expecting this. Mr. Premier, isn't there a lack of coherence here to ask young people to not have a prom, and yet during the next games of the Canadians, there's going to be 250 people in a section to be able to watch a hockey game, whereas the young people in schools are not 250 people to have a prom? We'll start with Dr. Arruda, and then I'll complete. Well, it has to be understood that we evaluated the situation of proms and we transmitted guidelines for holding the graduation ceremonies. It is possible per classroom, class bubble to do that. But a prom is not the same kind of contact that we have as in a stadium of 250 people. In a prom, it's more difficult to control classroom bubbles. People get very close. They drink alcohol. So we're really not, we're a lot more in what we call. You didn't see the end of the game as I did. Well, what I can tell you is that the end of the games at the Bell Centre, I was not there, and it has to be understood if there were people who hugged. It's not what's recommended. Technically, they have to go inside, sit down, and then leave adequately. So in what we consider that proms, particularly people not yet being vaccinated with their 2 doses this year, it was discussed with many of my colleagues in public health. It's an activity that is still at very high risk, in our opinion. I also would like to say that there's a difference between a party where people move around and an event where people are seated. I'll give you an example. I went to the theater last week. Everybody's wearing a mask and has a distance, except people who live in the same household who are in the same bubble. Well, it happens in a hockey game that people don't respect the guidelines, but the objective is to be able to say people have assigned seating, and in those guidelines that you heard at the Bell Centre, they have to remain inside their bubble. So there is a difference, I think, between a party or a bar where people would move around. As far as vaccination is concerned, the federal government has just announced that we'll be able to broaden the vaccines. What about for Quebec? What will be the recommendation? Is it already? Well, we had already said that people who have received AstraZeneca and who did not want to get AstraZeneca as a second dose would be able to change it. That's already in the guidelines. So that is what it will be applied. The CCNE and the CIQ as well are waiting to see whether there are any advantages to change, and the data of the studies made in England have not yet arrived, but we should get the results in June. To date, the recommendation is we keep the same vaccine that we got in the first dose. However, if you do not wish to have it, or if there's a problem to get the same kind of vaccine, we can change it for an RNA vaccine if you, if you have a AstraZeneca-style viral vaccine before. I'd like to get back to the call that you're making out to young people in particular, but we could also include age categories of 40 to 44 years of age as well. We consider ourselves young. So there is an issue with people not making appointments right now. It's clear that people are making appointments a great deal less. To what extent does that worry you with the perspective of reaching the targets? And secondly, do you fear that going immediately with going to second doses, you might discourage that further? Well, first, you're right. The age category of people between 18 to 44, and you'll see it again this afternoon. I'm going to publish a chart once again that shows where we're at, but the average of those four categories goes from 62 to 71%. So we are on average at 65%, so late by about 10% as compared to our objective of 75%, which is the minimum for each of the different categories. So, but it is only for the past few days that we saw the slowdown, because if we follow the curves, it's in the past 4 or 5 days that we saw that there was a slowdown to 62, 63%. So it's a little bit in that sense that the message today is very clear, is we want to get the clientele where they are. I said it, yesterday, if we have to go to parks, we'll go to parks. If we have to have happy hours with young people, we'll do it. We saw that there were some great initiatives that have already been started in Montreal and in Quebec over the next few days. We'll have access to the bus that is going to go from park to park to go and reach people. And in terms of communication, we are also going to be doing it by getting to people. But there's other factors that have been seen. We talked about it a lot. I'll give you the example of those, for example, who were finishing up school. Well, there were people who didn't want to go vaccinated saying, well, I'll wait to have my classes finished. So I think that we had to give them the time. I totally trust that we'll go get them, because once again, maybe I'll say a truth, but to get 2 doses, you have to have a first dose. And to get a first dose, well, you need to get vaccinated now, because you're going to see, we know that on the people who are older, when I show you the calendar next Thursday, well, on Thursday, you'll see that we're starting with 80, and then we're going to go back to 75, etc. And you're going to see that the second doses are going to, really, people are going to go right after them. And that is a message that the Premier has given, is take your appointments, make your appointments this week. And I'd like to end with that. To get the 75% in those categories, we're missing 200,000 people. It's not huge. Compare, we've vaccinated over 5 million people, but that, to me, is very important, because we need to have at least 75% in each age category. Now, as far as for the Aboriginal issue, there seems to be a federal, provincial issue in terms of the research that can be done on the old residential schools. Is there going to be a way to put the Quebec nation in the constitutional documents, as we thought? If there's a way of doing that, is there a way of trying to get results in Quebec so that families can finally have the truth? I'm convinced that yes. Let's remember, first of all, that we filed Bill 79 to help parents of disappeared children to be able to trace them back. The bill has not yet been adopted, but I've been told that it should be this week. Second, we talked with the federal minister to make sure that there is no issue between the federal government and Quebec, because, in fact, yes, the residential schools are of the federal government, but we are very open to collaborating, even in participating to search. So I do not anticipate any problems of jurisdiction between the governments. We will do, together with the federal government, everything that we can to be able to get as many information as we can, because it's terrible what those families experience and are still experiencing. I had some clarification concerning the zones. I was wondering, it's not clear for me whether people, I know that interregional travel have any restrictions, but can somebody in orange zone can go to a yellow zone or green zone? Well, in fact, it has to be understood that we're not preventing people from going from one region to another. Of course, it's not really recommended, but if you are in an orange zone, we'd like you to respect what you would do in your orange zone. That's it is to keep the behavior that you would have in your own territory. Okay, so that's the same as what it was before. A few months ago. I was also wondering, there are people who got a first dose of a vaccine against COVID-19 and who got a date for the second dose, which is on the 20th of September, whereas your objective is that it be done on the 31st of August. Isn't there a problem in the attribution of the second appointment? I'm happy that you're asking the question, Ms. Crête, because we wanted to be fair with everybody. And since we have people who had higher age categories who already had appointments in September, when we gave those appointments to the young people, we also gave them appointments in September. What we'll be announcing on Thursday with the collaboration of Clic Santé is that per age category, people will be able to get vaccinated earlier. So it's quite normal that we give somebody the opportunity who's 80 to be able to have an earlier appointment, and then to the 70 and then to 60. So even if we know that young people who are getting vaccinated right now would theoretically get their dose in September, we know that it's going to be earlier. But out of a feeling of justice for everybody, we wanted to give that opportunity per age category as well. I wanted to know, concerning the borders, Mr. Legault, people in the Outaouais are in orange, and they look forward to be able to cross over into Ottawa again without being intercepted. From what we understand with the question earlier, by the end of the summer, it won't necessarily be over. I was talking about international borders earlier on, but of course we're going to be following the situation of the pandemic in Ontario. For the time being, the situation is worse in Ontario than it is in Quebec, so we're going to continue being prudent. But there's also a big improvement in Ontario, and we're going to be following that closely. It's big improvement in the past week or two, and we'll try to, anyway, we'll keep an eye on that to be able to make a decision on the interprovincial border. People are wondering when the casinos will be reopened. Do we have any idea? Karaoke's and dance halls, can we think about that coming back in the fall? It is a possibility, yes. All the freedoms that we're going to be giving ourselves will be depending, I would say, first on the epidemiology, but one of the main factors is the vaccine. So the most people will get both doses. That will give us the possibility of avoiding a fourth wave, and also of having what we call a much more targeted surgical approach in our closures, rather than closing down an entire sector, etc. So I think that we have to see things come. We have to get to the green zone first, and the actions that people can take is to be vaccinated at a high proportion to avoid us getting outbreaks. And that is why we're targeting 75 or even higher, 80. We can go up to 95. I mean, that would be extraordinary, even more so, and in all age groups, to avoid having clusters of young people or unvaccinated people who will keep outbreaks going. Mr. Dubé, for the vaccination of percentage of health employees in CHSLDs, and I know that in Ontario is going to give training to employees who refuse the vaccine on vaccination, some information. Could Quebec do the same thing? Well, I think that is a very good example. The first thing, I think that what we've seen, Mr. Le Cavalier, since we asked employees who were not vaccinated to have a test 3 times a week, we saw that the percentages increased very quickly. We are now, I would say, on average, at 80% of people who are vaccinated. Of course, the training that you're talking about in Ontario, we did it, but maybe not as formally as it was done. So, of course, if we feel, for the same reasons that we explained for the young people, I think we'll have to go further. But for the time being, the progression of where we were not even at 60% less than a month ago, now we're at 80%. I think that encourages us to continue in the same way. But if we have to go further, we'll go further. Mr. Premier, I'd like to know the limit of 10 people in people's homes. Is that the best thing that we can wish for or hope for in 2021? Or when you abandon the color, when we get 75% of 2 doses, will that limit fall? Everything will depend on the epidemiology. I'd love to give you answers and saying we're going to come back to normal as such, but it will always depend on the epidemiology. It will depend whether there is no more significant circulation. It'll depend whether there's not a new variant. That means that we're starting to get outbreaks again. So for me, it's too early to say. But we will go with the epidemiology, and I'm the first to want for there to be parties at home with 40 people with no physical distancing for Christmas and, and all that. But it's too early to say. I'm really sorry. I'd love to be able to say it. It's my biggest wish. I really, really hope that next year, proms are going to really take place, because these are not decisions that we have fun making, because we know that we make people suffer. But it's been months that people have been sacrificing, and this is not the time to lose control. Hello, gentlemen. Monsieur Legault, earlier on you said that what happened, people going overboard over the weeks was predictable. Does that mean that things will calm down over the next few weeks? Well, I think that when we open up, things up a little bit at the beginning, people go overboard. Of course, there's no question of tolerating violence. We're going to make sure that in parks where there was, with police officers, be very present. But as I said early on, I prefer seeing people get together in parks rather than in homes. So let's try to respect the guidelines. But with the beautiful temperature that's coming up, I think it's normal to see people in parks. We've been talking a lot about the tunnel for the past couple of weeks. I'd like to bring more towards Mr. Labaume said that he was not going to show up again. I'm not asking you to give a name, but what kind of people are we going to need in Quebec City to be mayor? I'm not going to get involved in that. The citizens will decide. I was looking at my dashboard, and public, it's 94%. There's been a lot of effort, or 84%. And on the private, it's 81%. Thank you, Patrice Bergeron. Hello, everyone. Mr. Dubé, where are we at in terms of catching up surgeries? You had worked really hard. It also called the private sector. How long do we have left to reduce the waiting lists? Well, we are going to be having an update on that next week. We're trying to do it by the end of the session. There are two things that we're doing right now with Dr. O'Patterney is that we have a working group that is going to go forward a lot over the summer, because we have excellent collaboration from the Federation of doctors, specialists who want to go back to surgeries, but we also have to have collaboration with nurses and staff. So there's nobody who's going to be surprised with that. We want for our nursing staff to be able to rest this summer. So there's no question of us making the effort of asking them to delay their vacation like we did last year. So everybody's going to be working with the principal. And what Dr. O'Patterney, so I'm going to be answering your question, over the summer, the plan that is going to be finalized is I would love for the bigger principles to be given to you next week or in the week of the 15th at the very latest, but before the end of June. But of course, right now, when we are with, lockdown or end of the lockdown coming up, we find about 85–90% of people in our surgeries. So the list is increasing. We're at about 150,000, and our objective is to come back over a certain amount of time at what we were before the pandemic, that is 115,000, because within 115,000 surgeries that people are waiting list, it means that they will be held within the year. So the game plan that we're going to have over the next few weeks, depending on that working group, because doctors as much as nurses, the entire care staff wants to be able to rest this summer, to have a plan that we'll be able to execute in August and September. He also launched the idea of reaching young people where they are, in parks and public places. And I also know that in other countries like the United States, there are incentives offered, like a coupon for a meal at a restaurant or, beer, donuts. Is that the kind of formula that could be considered by the government of Quebec? We're looking at all sorts of formula. If you had asked me a week ago whether we would be doing happy hours in parks, I was surprised of that suggestion that I find to be very good. We look a lot as what is done as best practices elsewhere in the United States and Europe. I would prefer that things that are being developed right now be confirmed, but we'll get to you with other surprises over the next few days. English questions now.
First, good afternoon. I wanted to ask about you said there's probably going to be a bump in cases once deconfinement really gets going in Montreal and Laval. I just wanted to ask a bit about why that's deemed an acceptable risk at this point, that, we're going to be opening up and we likely will see more cases in the coming days or weeks after that happens.
We know that this virus can transmit with contacts of people. So it's normal that if there is more contacts, there is higher cases that can happen. But actually, the virus is still there. It's why we must be careful. It's why we must get vaccinated, 1 dose, 2 doses. But because we are in a lower rate, this over-transmission will not probably impact, I would say, our healthcare system. We're going to have some cases, but the healthcare system was not going to be impacted. And as older people are already protected because they have almost been received their 2 doses, the impact of the virus is acceptable to let us have, I would say, less measures. But it must be gradual. We must follow the rules for not going back to coming back from green, yellow, orange, and back to red. So we think that's the best period to do it because we cannot stay in prison for a long time. And I think that's okay. And we will probably see, like last year, in July, some more cases, but the things are going to be slow variations.
My second question is for Mr. Legault. It's from one of my colleagues regarding the migrant worker situation that we've seen. We understand migrant workers who arrive in Quebec do have to quarantine. But of course, where do they have to quarantine, and how can we be sure that place is up to an acceptable standard in Quebec?
Okay, this is under the jurisdiction of the federal government. So must ask your question to the federal government. But what I want to say is that it's important that they respect the quarantine. I understand that there are some rules put in place by the federal government, but even companies hiring those people, they should make sure that the quarantine is respected. And of course, I want to say that the situation we saw in Drummondville is unacceptable. We spoke with Mr. Demers, and we have also to make sure that they live in a place that is respectable and acceptable.
Philippe Autier, de Gazette. Good day. A small clarification for Mr. Dubé. On Thursday, you're going to give us the calendar of the second doses. Will you continue to give AstraZeneca as a second dose? Because I know, as Mr. Arruda has pointed out, there can be a mix in your policies now. There could be a mix of the types. But will you continue to give AstraZeneca in a second dose or switch to Moderna or something else?
Well, first, as we said, Philippe, it's the choice of the person to decide if they want to get the second dose from AstraZeneca. To give you some numbers, we have given roughly 50,000 of them in the last 3 days. And we have, as I mentioned, about 150,000 that are available. So we still have enough to run for at least a week if we keep the same pace. As you know, we had those appointments under a no appointment basis. Some people have asked if we could add some appointment. So we'll see how, but I would say within probably a week to 10 days that probably that first batch that we have will be consumed. The question will be, and again, I cannot give you the date, but we were told by AstraZeneca that we should receive a second delivery in the middle of June. So middle of June is in 2 weeks from now, and this will coincide with the length of the interval that we need to protect the 8 weeks. So I would say that there will be many other people, assuming that we have passed through the first doses, the 100,000, we will have enough AstraZeneca for those who want to have their dose with their second dose with AstraZeneca. And if they don't want, but now that we have a clear indication on interchangeability, then people will decide what sort of, if they want to go for ARN type.
And for Mr. Legault, for the Premier, we've saw quite a few scenes outside the Bell Centre, Victoria Park here in Quebec City, where people gathered, and they seem to not be respecting the rules. And I understand, as Mr. Arruda has said, there's a certain leeway in the hospital system now, but are you saying you're prepared to tolerate this kind of behavior because you have not talked about further enforcement?
Okay. First, people must know that there's a risk, even outside, to get the virus from somebody else. So you need to protect yourself first. Second, we have to be careful, but at the same time, I can understand that after months of being inside, people, they want to meet with other people, and I prefer they meet outside than inside. But I would like to repeat that to be very careful when you meet inside in yellow and green zones, that you have to wear the mask and keep your distances. It's important. There's a real risk. And so that's why, of course, we would like not to see that outside, but I can understand. And of course, police people, they will take sure that there's no violence, because it was too bad to see that there was some violence.
Katsuni, CBC.
Good day. Mr. Dubé, last week you sent a message to people aged between 18 and 44 years old to, you're dragging your feet, get your appointment, your first dose ASAP, and obviously nothing has changed since last week. And now you're saying we'll find solutions, original incentives, so they will convince them. What are you thinking about exactly in, if you have different ideas that you want to put in place, but how far can you go in these original means?
Well, we talk about that every day with our group, and as an example, somebody last weekend was saying, well, why don't we try something in the park? Because that's where we're saying to young people, go in the park, go outside, because that's where you should be and not in backyards or in the houses. So, and we saw the reaction. We already have vaccinated 1,000 doses in West Island in one park over the weekend. So this is a formula that seemed to work. As I mentioned, we'll do 5 to 7 cocktails. I don't know how exactly they will be arranged, but because that's what young people want. They want to see each other.
7, you mean the time.
The time, that's right. No, it's not.
5 or 7 cocktails.
You can see he's watching over. That's good. But and there are many formula. We have those. Sorry if that's not the right translation, but éphémère. I don't know how you would translate that, but we have buses that will go in certain area to join certain people. So I think that, but I see what's worked the best. We've seen it in the last few days, is no appointment and extending hours. So for example, in Montreal this week, we'll move the hours. Instead of stopping at 8 o'clock, we'll try to stop at 10 and 11 at 11 o'clock or midnight. So this is what we're looking. So I said that many times, we're adjusting to clientele, and this is what we're going to do in the next few weeks.
Good. Looking back to what happened with the 215 remains of children in Kamloops. Yesterday, your Indigenous Affairs Minister said it's a federal responsibility. We have to wait and see. Today, it's a different answer. How important for you, Mr. Legault, it is to take part of this operation and make sure there are no remains, or there are remains of children from residential schools on your territory?
Okay. First, we are ready, and we have to make sure we do everything we can to discover exactly what happened. And you know that we already tabled the Bill 79 that must be approved in the next few days to help families having lost children to know more about what happened. Regarding the pensionnat, they are under the responsibility of the federal government. So even if we want to dig and do something, it's not under our jurisdiction. But of course, we'll do everything we can to collaborate with the federal government to get as much information as we can.
Raquel Fletcher, Global, bienvenue parmi nous. En personne.
Ben oui, avec les couettes, hein?
Right, it's fun to be back in person. My first question is, I guess, for Mr. Legault or Mr. Dubé. Only 15% of 12 to 17-year-olds have received at least one dose, yet more than 500,000 doses of Pfizer have already arrived this week to Quebec. You mentioned, in terms of Kathy's question, incentives for young people, but particularly for teenagers. I don't know if they will be as receptive to a cocktail hour. Is that what we can call it? They're not cocktails. It's a cocktail hour with the vaccine. Yes.
That's right.
But for teenagers, for that 12 to 17, why do you think there are so few of them?
No, but let's divide in two groups to make clear, to be very clear. 12 to 17 is going even faster than we thought. Because remember when we said we would do the 12 to 17, we said roughly we thought that 20% would be done to vaccination center, say outside the schools, and 80% would be done through the schools that start next week. We already have 40% that have done through vaccination center. So we are ahead in that group. I think this is very good news because people decided that either they went by themselves or they were with the parents. So the 12 to 17, honestly, today we don't have any worry. They'll do this probably well above 75%. The group that we're talking about that has slowed down in the last week is 18 to 40, okay? And at 40%, I'm just looking at the detailed number, but 40 to 45 is roughly at 75%. I think we're missing a point or two. But when you go down to 18 and 24, that go as low as 62%. This is where it has slowed down. So the point that I've made is we will adjust. I said about vaccination in park, we're going to extend the hours. So we have, I think we have a communication that is targeted to those groups, but also we adjust to their hours. And I think that most of them, some of them, they were to finishing school and they were in exams. So there are many reasons where we need to adjust to them. I think we have a 10% to look. And the point that I made earlier is that this group in total, it's not a big number, but we have about to go 200,000 appointments, 200,000 on a population of 2 million of that group. So it's doable, but we want them to take advantage of the next week because as of next Monday, in a week from now, people that are going for their second dose, they'll take their appointment. So we're telling them, go right now because it's going to be more difficult to get those appointments in 2-3 weeks from now. That's the point we're making.
Okay, perfect. My second question is a follow from some of my colleagues have alluded to it already. Mr. Lafarrière mentioned the games, the Canadians playing. I want to just put a finer point on it. You said you would rather see people outside for instance, watching TV on their balconies than inside their homes. But what we did see in some of these games was a lot of celebration, a lot of people looking like they were partying, rather than what Dr. Arruda said about sitting in a stadium where you're just watching something. It did appear to be more celebratory, more parties. What were you thinking when you saw that? Because you've been cautioning, you've been saying the word prudence a lot. When you saw those images, were you like, did it make you cringe?
They don't sell any beer at this Bell Center? No? I think that the rules are clear. You get into the Bell Center by different doors. So it's 250 people per door. They have a different toilet. They have to stick in their bubble during the game. So the same thing I said in French, I went to the theater last week, and it's the same thing. So you can sit with your wife or your husband, but you have distance between the different people. And you have to wear the mask all the time also.
But so, I mean celebrations in general, maybe even people who didn't go to the stadium.
Yeah, but okay, first we saw some celebration on the street outside of the Bell Center, so it's not as worse outside as it is inside. But I think we have to follow the rules. If we want to continue to put in place our plan, we need to follow the rules. And right now, when it's inside, you have to be at your place and keep the distance.
Merci.
It's not a party.
Merci. Donc, juste avant de...
Thank you. So just before saying goodbye, I would like to relay a question that was transmitted by a colleague. I think all the colleagues will be happy for an answer. They're asking for your reaction, Mr. Premier, to the decision of Air Canada to give $1 million in motivation premiums to its upper management. Well, it's a private company, but that is difficult to accept because Air Canada got help from the federal government. It is difficult to say, well, this year it's not a good year on the results, there's no profits, so no bonus. But now we'll still find a way to give bonuses in a different way. So I imagine that it's an incentive to get to profits in the following years. But let's say that it's not ideal. Thank you. This puts an end to the press conference. Thank you and have a good afternoon.